Our medical correspondent here on KTN News with us. I believe you can see her on your screen there. Doc, karibu sana. It's great having you on the show. We are keeping that 1 meter distance.
Definitely 1 meter right? distance. You don't want to take any chances. We are observing social distancing, even as we try and deliver news to Kenyans and update them on what's happening with the coronavirus, COVID-19 disease, that we have 7 cases currently reported in the country. Yes.
Certainly. Yeah. Take us through the numbers, the global trends, Doc.
So the global numbers, remember that this was first reported on the 31st of December 2019. That's why it's COVID-19, coronavirus disease 2019. And so far we have slightly over 207,000 confirmed cases globally. China obviously has half of those cases. Italy is the second country with the highest number with over 35,000 confirmed cases. Iran with over 17,000 confirmed cases. Spain 13,000 and South Korea 8,000. Those are the 5 topmost countries that have recorded the most number of confirmed cases of the COVID-19 disease, the coronavirus pandemic that we currently are experiencing across the globe. Now, we have recorded 8,648 deaths according to the WHO, and a quick computation of that shows you that it's about 4% case fatality rate. 4% of people who would get this disease would succumb, and that means 96% of people, which is definitely good news if you ask me, are expected to recover. And now of note is that the people who have lost their lives to this COVID-19 are people who are most vulnerable. That is the elderly, that has been seen from across the globe. People who have other pre-existing conditions, and somebody was asking me, these pre-existing conditions, you only see it in insurance, when you're filling insurance form, but it's like diabetes, hypertension, cancer, people on any medication that suppress their immunity. Those are the people who are worst affected by this.
That explains that case in Burkina Faso?
Yes, yes, that explains it. And actually, I've been telling people, anyone who has good immunity, who's of good health, is likely to survive. But our elderly population and people with any of these conditions that I've talked about are the people at most risk. And those are the people that we should reserve the hospital to. Remember, we have meager resources, we have limited resources. So if all of us flood the hospitals, then there was that one person who needs the hospital when we, who would be staying at home and recovering at home, would deny the opportunity to be treated while in hospital. So all these numbers have been in about 166 countries globally. Now, looking at Africa, 33 countries have confirmed coronavirus cases, Kenya being one of them with 7 cases. 635 is the total number of cases that have been recorded in Africa. Remember that this has been sort of like a global trend where I've seen that Africa has been the last continent to be affected, and somebody was asking, could it be an indication of the economic development of the globe, where it's around the globe, then Africa is affected last? Could be. That could explain because of the travel from country to country. But anyway, 33 countries in Africa, 635 confirmed cases, 17 deaths in Africa, and though so far we have 48 recoveries, we expect that there would be more in Africa. And the good news is that the people who've been confirmed in Kenya are expected to recover. Last that we checked, they were doing well. And so we hope and we expect that so far the cases in Kenya, people would walk home healthy and that we would be able to contain. You know, I've been saying that for the current situation, we are not looking at stopping the spread of the coronavirus because it's already here. So what we are looking at doing is delaying transmission. And when transmission has happened, we're looking at containing to where it is. That's why people are asked, maintain social distance, stay at home, and if you're at home, isolate. If you fall sick at home, if you don't fall in any of the categories of the vulnerable people, then your immune system should be able to fight it. Hydrate, manage the fever, manage any cough, but stay at home. At least it can be contained within that home environment. If you are in doubt, the 719 number shared by the Ministry of Health, you call that number because it has medics manning it, so they'll be able to guide you and advise, do you need to go to a hospital or are you okay? But if you develop difficulty in breathing, that's a point to go to hospital. So not everyone should be rushing to our outpatient centers, our accident and emergency centers, suspecting to have coronavirus. And should you be a suspect, or should you suspect that you have, I think it's only prudent that the first thing you do when you report to a healthcare facility or a healthcare worker is to declare that you suspect that you might be having coronavirus. Because remember, these healthcare workers are like you and I. They have families to take care of. They have families that they've come from. So you also need to protect them. So this is that one instance where you have to mind your neighbor as much as you're minding yourself. So it's best to declare that I think, for reason A, B, C, and D, that this may be coronavirus, so that they can take the necessary measures so that you don't end up infecting them. Remember that we do not have many healthcare workers. So if any one of them falls sick, or if any one of them is isolated, then it means we have pulled a certain critical workforce from the hospital environment to attend to some that would have attended to people who are in critical condition. Remember, people are still suffering from heart attacks. Mothers still need to deliver. People are still getting strokes. People with diabetes still need their sugars checked. So let's be mindful of the resources that we have. I know we are scared about all of these things, but if you don't fall into the case definition, then there's no need to go to hospital.
Doc, we're mentioning the elderly as part of the vulnerable, and you've mentioned many others, but how about the children?
So from what we have seen so far globally, children have not been affected as much as this group of people that we've mentioned. We don't know yet. Maybe the immunity is strong enough to fight the coronavirus, but luckily children have been safe so far. And here in Kenya, we're getting reports of actually children are the ones who are tasking their parents with maintaining hygiene, that you need to wash your hands. You should not touch men, meaning mouth, ears, mouth, eyes, and nose.
Yeah, men.
Yes.
Mouth,
eyes and nose. Yes, and it's children that are reminding the parents that these are the things that we need to do. So I think it's just about having this conversation about hygiene at our home level, where if you in your household, you have maintained hygiene, you have maintained isolation, and I do the same, then collectively as a community and as a society, we will be safe, and we will be able to delay or contain the transmission of the coronavirus.
Doc, before I let you go, let's talk about these numbers. This is in Africa, 48 recoveries. And in the previous slide, if we could have it on the screen, we had about 80,000.
More than
80,000 recoveries. Is it permanent? Because, you know, in my little knowledge in this medical world, we had SARS-CoV-1.
Yes.
Should be in 2002 or 3?
2003, 2004.
But then there were some of these cases which came back again, which recurred after, you know, one recovering. So could this be the case for this 48 in Africa, more than 80,000 globally who have recovered, Doc?
Okay, so the coronavirus, they are a family of many viruses. So what we are seeing now, the one that is causing COVID-19, is a strain of the many viruses. So the SARS-CoV-1 was the initial one that we experienced in early 2000. Then we had the MERS, the Middle Eastern Respiratory Syndrome, which was from the camels. Now we have this. Common cold is a coronavirus. So it's just a strain of the many coronaviruses. That's why this was initially called the novel coronavirus, because people did not know it was a new strain. It's new strain. So even as we go along, the scientific world, the lay public, everyone is learning about this as we go along. So whether somebody will develop immunity after developing this is still unknown. Whether we'll be able to get a vaccine is still unknown. Whether we'll be able to get a cure for this is still unknown. So that's why the emphasis right now is on maintaining, is on delaying transmission or containing transmission when it's already happening there. So that's why the big campaign on wash your hands with soap and water, not necessarily sanitizer. Not everyone can afford sanitizer, but the best is actually soap and water, and it's any soap. Soap and water is the best. Maintain social distance. So, and this social distance does not mean when you come at work you're maintaining 1 meter difference, but in the evening you're out with friends and, you know, partying and whatnot. It's actually isolation. I think it's about time we take it seriously, because we do not want to arrive at a situation where we get a surge So we expect, statistically speaking, because the 7 confirmed cases in Kenya, for example, have been interacting with us in society. We don't know who it is that they have met.
As of yesterday, the government was looking for 85 people.
Yes, and the numbers will increase.
Yeah.
The numbers are expected to increase, the numbers of those being traced and the numbers of those confirmed cases. So as long as our curve does not spike and surge such that it demands a lot of the health system, we're doing well. So if we have 2-3 cases being reported every day, that is okay. Our health system as it is now can handle. But what we are trying to avoid is that surge. So that's why these government measures of closing schools, asking people not to go to places of worship, asking people to minimize social gatherings, to minimize movement. Different institutions are scaling down in the number of personnel that are reporting to work, so that
including here,
yes, though we are an essential service because we have to keep informing the public. But these measures are to help delay the transmission. And even if it happens, then we'll be able to know that it is this particular homestead, and we are able to monitor you from that particular house, because it's better to contain it as opposed to when we have a community spread or a society spread, and then now it becomes difficult, like what we've seen in Italy, where it's been difficult to contain it because all of a sudden there was a surge and the health system could not handle. And the question has been, if a developed country has had a difficulty managing this surge, what about us? So this is a call actually to everyone to play their part, because if you observe all these public health guidelines, and I do, then collectively as a society we will, and we will reserve the little resources that we have to attend to those in the vulnerable group and those who are most likely to suffer the worst effects of this particular disease.
Doc, in your capacity as a medical doctor, are we looking at a possible total lockdown in the country?
Speaking to different sections of my colleagues, nurses, medical doctors, lab technicians, for them a total lockdown would actually work best, because it means you'd be able to contain this, more or less like arrest it at where it is, and you would be able to quickly trace and track everyone that has come in contact with the 7 people. It would make it easier, because then I don't have to worry about who did you meet at work, and and the person you met at work, who did they meet after that. You know, the tracing and the containment will be much easier if there's a total lockdown. But now the issue with the total lockdown is who will suffer the most, which are your most vulnerable groups of society. And these are the people who depend on daily wages, who have to go to work every day to make a living. So what happens to them? Does the government come in and put money in their pockets or food on their tables? What does the government do? So the issue of a total lockdown, on a public health perspective, it works. But now you have to think at society holistically. Where would these people get food? Where will they get water? How would they go about their business? So it's a bigger conversation apart from a total lockdown. What about your most vulnerable groups of society? And we have seen some of our colleagues who have talked to these people in some of the informal settlements, and they're like, okay, if there's a lockdown, where do I get food from? And it's a very valid concern.
Some people live from hand to mouth.
Yes. So a total lockdown is recommended, but then government has to think about social protection of all of those people. And even the people who are formally employed, what happens to them? Because now they're not able to work, it means the employer is losing out on man hours. Do they still pay you? And you do not come to work.
Doc, is a hotel in Nakuru. We had a link with Joanne Leting earlier on, and they've sent their employees home on unpaid leave. A hotel in Nakuru, Bontana Hotel. Doc, before I let you go, what are the lessons that we can pick from 2 countries, China, Italy?
I think the lesson that we can learn is first from China, and I think it's what we are applying here as a country, is that when Hubei province was on lockdown and the other provinces picked up a lockdown, then they were able to control the rising levels of the number of people with coronavirus disease, the COVID-19 disease, so they were able to maintain that curve at a flat line, the other provinces. So, and I think that's what we are applying here. When you look at Italy, their lockdown came a bit later after the surge had happened, and already their health system was suffering the effects of the coronavirus pandemic. So I think the lesson that we have learned and what we seem to be employing here, though it's partially, is that lockdown to contain and to delay and contain the transmission of the coronavirus pandemic, so that if we are to get at its worst, then we are able to handle it and balance it as a country. So this is really a collective, it's a collective approach by all of us, where each and every one of us has a role to play, and government even has a bigger role to play, especially for the vulnerable and the most, the people who are at most risk of suffering the social impact of a lockdown.
Indeed, Doc. Thank you. Always a pleasure having you on the show. Dr. Mercy Korir there, our medical correspondent here at KTN News. And of course, we'll be having you tomorrow and the days after. Thanks, Doc. We appreciate it.
Thank you.
Now,